Thank you all for joining us today for this presentation of our survey of Medi-Cal enrollees. I am Chris Perrone, Deputy Director of the Health Reform and Public Programs Initiative of the California Healthcare Foundation, where I have been leading our efforts to help improve the Medi-Cal program for over 10 years. We have a terrific attendance here in the Sacramento Sheraton, and we also want to welcome those who are participating via webcast and by phone. We have well over 300 people who are participating that way as well. I'm pleased to be here with you today to share the findings from our statewide survey of Medi-Cal enrollees. And it was 12 years ago that, right about the time that I joined the California Healthcare Foundation, that we conducted our first ever statewide survey of Medi-Cal enrollees about their perceptions of the program and their experiences with it. We learned a lot at the time and hope to learn as much this time around. And those of you who woke up to your newspaper or radio, whether it was the Los Angeles Times or the Chronicle, San Francisco Chronicle, the San Jose Mercury News, the Contra Costa Times, or maybe KPBS, perhaps saw the news coverage on this. So it's terrific to see that the news media is as interested in this story as we are, and it's perhaps a reflection of the fact that Medi-Cal is so important to the people of California. We know that it covers 1 in 5 Californians, but clearly it touches many more lives than that and has a profound impact on the state's budget as well. When talking with the press, one of the questions that they ask is, so why conduct this study now? You did it last 12 years ago. Why did you choose this time to do it? And there's really a couple of reasons. The first is that since 2000, the year 2000, when we last did this survey, Medi-Cal has changed a lot since then. So in 2000, for example, there were 5 million people enrolled in Medi-Cal, and now there are over 7.5 million. In 2000, Medi-Cal covered most every optional benefit that is allowable under federal law. And today, we are approaching the 3-year anniversary of the elimination of 10 optional benefits for adults, including dental services as well as cuts in some other services, including in-home supportive services. And in 2000, fee-for-service was the predominant delivery system in Medi-Cal. And while it still plays a very, very important role, now 60% of enrollees are enrolled in managed care plans, including most seniors and people with disabilities who are not covered by Medicare. So Medi-Cal has changed a lot, and that is certainly one reason to conduct this survey again. Another reason we thought this was a timely point to conduct the survey is Medi-Cal is on the verge of some profound changes. So the legislature has passed, the governor has signed cuts to provider reimbursement rates that have not yet been implemented but may be very soon. Due to the ongoing budget difficulties, we may see increases in enrollee co-payments, and there is, of course, plans to expand managed care for dual eligibles. And then there is this small little thing called the Affordable Care Act, which, when implemented, will increase Medi-Cal enrollment by 2 to 3 million more people. So Medi-Cal is truly at a crossroads, and we thought this was a terrific time to take stock of the program, see where it is, how it's working for the people it serves, its enrollees, and to establish a baseline by which to measure the impact of some of the changes that are about to happen to the program. When we discussed our desire to conduct a survey with the director of the Department of Healthcare Services, Toby Douglas, we were delighted that he and his senior staff were as interested in conducting the survey as we were and in hearing about the experiences of their enrollees. And I want to thank, in particular, Brian Hansen and Michael Fitzwater for their help in making this survey happen. Our goals for the survey were to understand the experiences of Medi-Cal enrollees with their overall impressions of the program, their experiences with the enrollment process, their experiences finding and getting care from doctors. And as you will hear in the presentations, we were also able to examine the responses by subgroups, and that was one of the benefits of working with the department on the survey, is we were able to really dive down into different subgroups of the Medi-Cal population. So we were able to look at responses among parents for their children as compared to the responses for other adult enrollees. We were able to compare the responses of people with disability versus other enrollees, compare those in managed care to those in fee-for-service, compare among people in different ethnic and racial groups, compare English speakers and Spanish speakers. So a number of different comparisons. The other thing that we were quite excited that we're able to do is we had, a few months before conducting this survey, conducted a survey of the general population in California. And so we're able to compare the responses of Medi-Cal enrollees about their coverage and care to those of other insured populations in California. And we're able to compare enrollment perceptions and perspectives about Medi-Cal among current enrollees with those who will be newly eligible in 2014. So we think the findings will be quite rich and offer a number of important lessons for the future. There are, of course, with any survey, some limitations. This survey was conducted in only 2 languages, English and Spanish, and we didn't include dual eligibles in the survey or others over the age of 65. And that, in part, is because we really wanted to hear about perspectives and experiences with the Medi-Cal program, and including dual eligibles would have really sort of muddied up the picture because their primary source of coverage is Medicare. It's also important to recognize that many enrollees have cognitive impairments and speech limitations that make it hard to participate in a telephone survey. And so we recognize that the study findings may not be fully representative of that population, even though we are able to, as I said earlier, present the results among people with disabilities as compared to other enrollees. We recognize that some people may be left out of this survey. Nevertheless, we think the findings are quite informative and timely. We think many will confirm your beliefs and understandings and knowledge about the program, and that others may surprise you, as they did us. We also, in addition to the survey results, have some brief videos to share with you. My colleague, Jamie Brooks, will describe them further. So I'll just say that we invited 4 current enrollees to share their experiences on video. And we're going to present 3 of them today. They're very brief. Each one is unique, and we think they're quite reflective of the survey findings. So they illuminate the findings from the broader survey. We also prepared 2 other videos with state officials, one with Healthcare Services Director Douglas, and a second with Assembly Member Holly Mitchell. Because we have Associate Director Len Finocchio here today on behalf of the Department of Healthcare Services, we will not be showing Toby's video, but that is available online along with the 4th video of the enrollee. But we will be showing Assembly Member Mitchell's video. But both present perspectives on the challenges facing Medi-Cal and the opportunities ahead. And we really encourage you to visit the website. We think you'll be, it's well worth your time both to see the 4th enrollee video and as well as the video of Director Toby Douglas. Before I hand things off to my colleague, I want to briefly review what's in your packets. So we have the agenda for today's program, and I'm going to hand things off to Jamie and introduce her in just a moment. And that will be followed by a presentation of the findings by Tresa Undem of Lake Research Partners. And then we have a terrific reactor panel of 2 thoughtful, well-known, well-respected experts on the Medi-Cal program, Elizabeth Landsberg and Len Finocchio, and we're delighted to have them here today. We also have in your packets 2 presentations. One is the chart book that we posted online today of the full synthesis of our analysis of the findings, and the other is a smaller set of slides that are the slides from Tresa's presentation. So you have those available to follow through if you'd like. And then in bright green, familiar to many of you who have attended our briefings in the past, is our evaluation form. So I will, as we always do, invite you and encourage and urge you to complete that. It is really the way that we get your feedback as to whether this worked for you, what worked well, where there are opportunities for improvement, and particularly because the micro-documentary videos, these short videos of the enrollees and state officials are new, we'd like your feedback on that as well. One thing that's not in your packet is the kind of detailed cross-tabulations of the findings, some of you may not be interested in those at all, but others of you may. And I invite you to take a look at those. They are posted online on our website. And so if you're interested in diving into the findings a little further, you can certainly do that. So now it's time for me to turn things over to my colleague, Jamie Brooks. Jamie joined the California Healthcare Foundation 6 months ago, and we are delighted that she has. Jamie is a lawyer by training and came to us from Kaiser Permanente, where she led national efforts in quality improvement and risk management. And before that, Jamie worked as a staff attorney in the North Carolina Office of the National Health Law Programs.
Thanks for the introduction, Chris. Hi, everyone. I'm Jamie Brooks. Just one bit of housekeeping. If you have your cell phones on, if you could put them on silent or mute, that'd be great, or vibrate. I'm really excited to be here today and share the information that was uncovered in the survey and in the short videos you're going to see in just a moment. In fact, before I turn it over to Tresa to present the research findings, I want to tell you a little bit more about the videos. Thanks to our communications department's really hard work, we do have the 6 videos that Chris mentioned, and we only have the opportunity to show 4 today. So like he encouraged you to do, I'd go to the website and check out the other 2. And on the evaluation that he asked you to fill out, there's also a question about your feedback on the videos, so we'd love to hear that too, so just another plug for that. Being that I have the microphone, I'm going to take a minute and tell you my feelings about the videos. I think that they really give us an opportunity to drop into the stories of enrollees that were interviewed for this research. I think so often we can get caught up in the graphics and the statistics and the percentages and forget that each statistic and each percentage point is a real person and a real family. So I think that they really give us the opportunity to reinvigorate our energy and our efforts around this work. So with that, I'll introduce the first one. And you're going to see a gentleman named Theron. And Theron is the father of a profoundly deaf teen. And he's always felt that Medi-Cal is the best option for coverage and services to meet his daughter's needs.
I live in Hayward, California. I am a shipping manager for a swimwear company. I have 2 daughters, ages 12 and 13. One is deaf. The challenges that are facing my family and I are not being able to afford health care through my employer. I make too much money to get on Healthy Families, but it's too much to cover through Kaiser. Getting care through Medi-Cal is better for her because I have access to more facilities and more people to help me with her condition. I have access to doctors that know sign language, and that makes her feel more comfortable and more safe going to an environment like that. The reason why I wanted her covered by Medi-Cal instead of a private is because it's state-run, and I can go to any hospital to receive care. Application process took me about 10 days to complete. I filled out the paperwork, printed out myself, sent it in. It took about 7 to 10 days for them to contact me with the correct resources for my daughter. Medi-Cal has helped my family stay positive and stay healthy and provide the necessary care that I need for my special needs daughter. Without them, I wouldn't be able to afford health care for her. I hope that one day Medi-Cal can cover and help all people that are disadvantaged or low income get the health care for their loved ones that they need.
The next video we're going to show you features Jolena, and Jolena's husband and 2 children are on share of cost Medi-Cal due to their income. And you'll see what challenges her family faces even while having coverage. And if any of you have had the opportunity to read some of the newspaper coverage this morning about this event and the survey, Jolena's been interviewed in the LA Times, San Francisco Chronicle, Contra Costa Times, and a few others. So here's her story.
I live in Oakland, California with my husband and 2 kids. I work for a small design firm in San Francisco, specializing in designing medical devices. I get health coverage through my employer. My husband is a full-time grad student, so he is under the Medi-Cal coverage, and so are my children. It's important for me to have health coverage because I have type 2 diabetes. My husband has cluster headache. It's worse than a migraine. He has to get special prescription for those. When I first applied for Medi-Cal, it took me having to go there physically, filling out tons of paperwork, and also waiting in line. But once I got the coverage, it was fairly quick. I think it'd be easier to do the application online because you can do it anytime, anywhere, and not have to go and wait for a long time. Since I work, our Medi-Cal coverage has a shared cost, which means we have to reach about $2,100 before Medi-Cal can start paying for it. So we do pay most of it out of pocket. It definitely limits the kind of care because sometimes if my husband feels that he needs to go see his neurologist, which is obviously not going to be $2,100, instead of paying out of pocket, he doesn't go. It's not affordable for us. It would be great if more private practices accept Medi-Cal patients. Medi-Cal would be easier if the income level was decreased, if they had more coverage like dental and vision, and an easier application process.
And we'll see a few more of the videos throughout the rest of the briefing, but let's segue to the presentation of the survey results. The survey was conducted by Tresa Undem, who's here with us today, of Lake Research Partners, and the foundation has worked with Lake Research Partners on many projects over the years. I'll read you Tresa's bio before I turn it over to her. So she was the researcher and will present on this project, and she's been a partner with Lake Research Partners since 2004. She leads public opinion research on a variety of health-related policy issues, including health reform implementation, access, affordability, health IT, use of PHRs, chronic illness, and healthcare quality. She's worked on numerous projects related to Medicaid and CHIP, including research for CMS, the Robert Wood Johnson Foundation, the Henry J. Kaiser Foundation, our foundation, and others. The research includes assessing experiences with programs, identifying motivations and barriers to enrollment, testing, outreach, communication, and strategies. And she's working currently on a number of projects around healthcare reform implementation, including informing public education efforts around exchanges. And in the past year, she's briefed numerous state and federal policymakers in her work, including White House staff, Secretary Sebelius, and the CMS leadership. I would just say before I turn it over to her, if you have questions, we are going to have a discussion Q&A portion of this briefing, so I'd ask that you wait for your questions during that time. However, if you need clarification during Tresa's presentation, let us know and we'll make sure we address that while she's presenting.
Thanks, Jamie. So I am really excited to be here. We do, as Jamie said, our firm does a lot of research around Medicaid, around CHIP. We've been doing it for over a decade in many, many different states over the years. We've at the federal level as well. And we're excited because this information, a quantitative survey of Medicaid, in this case Medi-Cal enrollees, really does not exist. This information is just not out there. From all the work we're doing in different states, from what we know what CMS is doing, there's just, these data aren't out there. And as Chris was mentioning, this is such a critical time where decisions are being made that's going to affect this population. This is a vulnerable population. As we look to 2014 and the newly eligible population and 2 to 3 million more Californians being eligible for Medi-Cal, it's just a really important time that we can actually hear what do enrollees think of the program, what are their experiences with the program, around access, around enrollment. So I'm really excited to be part of this project and really applaud the foundation for taking this on. And the reason other states haven't done it is because it is a really difficult, challenging population to survey. We're grateful for DHCS to work with us, very generous in supplying sample and working with us to conduct the survey. So on the introductory slide, just quickly, you can go to the next slide, a couple more slides. There we go. Okay, so I'm going to go briefly over the methods. Chris already talked a little bit about the methods. Then I'm going to talk quickly about general perceptions toward the program and toward Medi-Cal coverage. Then I'm going to go into experiences around enrollment, experiences and attitudes around access, and then get into some of the subpopulations. I'll end with some findings around newly eligible adults. As Chris said, we did a survey last year that we looked at different segments population, including the newly eligible. So we have some findings around that. I was going to do a summary of the data, but then I decided summaries are boring. Why not just get to the data? So in 10 seconds, a 10-second summary is basically the findings are very positive. And from the work I do in other states, again, it's all qualitative, but from the work I've done in California and in other states, I was frankly surprised at how many findings were really positive about the program. There are a couple challenges, couple areas of improvement, especially around access to specialists, which we'll get to, but really positive overall. A couple challenges, and then a couple challenges around subgroups. Certain populations tend to fare better than other populations, which we'll get to. So on the next slide, just briefly about the survey methods. So most of the data I'm presenting is from this survey around enrollees. It was conducted by telephone. The sample, as I said, was provided by DHCS, probability sample of enrollees of the population we wanted to study, which, as Chris said, was under 65, full scope Medi-Cal beneficiaries or enrollees, and we excluded those with Medicare, as Chris said. This was conducted in December of last year and into January of this year among 1,083 enrollees. Now, as Chris said, when we talk about, there are a couple places I'm going to cite another study that we did last May among the general population. I'm going to talk about the newly eligible population, which we took from that survey, and then we can compare enrollees with Medi-Cal, adult enrollees with Medi-Cal from this survey, with adults in the state with other types of coverage. So we're able to make those comparisons. Those adults with other coverage were from this general population survey. That was conducted online using Knowledge Networks. Knowledge Networks is the only survey research company in existence that truly has a probability sample of Americans, including Californians. If a household does not have the internet or does not have a computer, Knowledge Network supplies both. They're used by top researchers around the country. So it's very, very legitimate, solid research, unlike any other online vendor. So let's go to perceptions of Medi-Cal. We can go to let's go to the next slide. So just quickly overall, very positive impressions of the program. 90% of enrollees say that Medi-Cal is a very good or pretty good program, really huge numbers. 43% say very good program, 47% say it's a pretty good program. Only 6% say it's not such a good program. So overall, very positive, clearly a valued program for enrollees. We also asked about coverage on the next slide. And perceptions about coverage. Does Medi-Cal cover most of the care people need? Yes, 78% of enrollees agree that Medi-Cal covers most of the care people need. 5% are not sure, 16% disagree. I'll get into sort of those groups who tend to disagree a little bit more, but still overall about 8 and 10 saying, satisfied with the coverage of Medi-Cal. We also asked on the next slide about access to quality, high-quality care. So do enrollees feel that Medi-Cal provides access to high-quality medical care? And again, we see a pretty large majority, 69% agree that the program provides access to high-quality care, 10% not sure, 21% disagree. So on these broad attitudinal measures about the program, about the coverage of the program, very high marks, very positive views from enrollees. Next, I'm going to get into experiences with enrollment, and this set of findings did kind of surprise me because we've done qualitative research among Medi-Cal enrollees. We've also done it in a number of states across the country, and we hear a lot of feedback on the enrollment process. We do hear, you know, it took me, I had to take 8 days off work to apply, or, you know, the enrollment workers weren't friendly, or the application was too long. We hear those things, but the data, as we did the survey, we really found positive experiences overall. 77% of enrollees say that the enrollment process overall was easy. 40% say it was very easy, 37% say it was somewhat easy. When we looked at this chart, it shows different aspects of the enrollment process. So we asked, was it, you know, do you agree or disagree? The oranges agree. It was easy to figure out where to go once you're inside the county office building. I'll get to this in a second, but a majority of enrollees enrolled at the county office building. 89% say agree, yes, it was easy to find the office. 83% say places were open during convenient hours. 77% say the application was easy to fill out. 74% say all the workers they dealt with at the county office were friendly. This was among people who enrolled in the county office. Places to go are pleasant. The application is short, it dips a little bit. 61% agree, 31% disagree. And when we look at the crosstabs, the people most likely to disagree that the application is short, so those who think it's too long tend to be older enrollees, so 45 to 64-year-olds. And then the one area for improvement here around the enrollment experience is the wait time. So do you agree the wait time in the county office was short? Only 42% agree. 56% disagree. So that's an area, and we've done qualitative research in the state too, where that's one area that, and I think Jolena might have mentioned it in her, in that little film, that's one area where she had to wait a long time. Sometimes people can't get a babysitter, so they're there with their kids. So people don't know if they're going to be there an hour or all day, and sometimes they don't, you know, it would help. They say it would help if they, you know, knew how long to wait. So that's one area for improvement. But overall, again, pretty positive findings. On the next slide, so again, as I said, where people enrollees enrolled, 74% say they enrolled at the county office, 2% enrolled online. 8% at a doctor's office, clinic, or hospital, 7% by mail, 4% by telephone, 4% at a community-based organization. We also asked, if you had a choice, where would you want to enroll? And 20% would want to enroll online. So 2% currently enrolled online, 20% would want to, so a big gap there. We also see about 61% want a variety of in-person options to enroll. So at the county office, 50%, at a doctor's office or clinic, 9%, at a community organization. A variety of methods are preferred, although right now, currently, most people enroll at the county office. So one reason, on the next slide, one reason why only 2% have enrolled online is because most enrollees aren't aware that there are online options that exist. So 79% are not aware of online options, 21% are aware. So this speaks to, you know, as online options develop more and improve across the state, that awareness also, we need to increase awareness of these options since more do want to enroll online. So let's get into access. access to care. So first, on the next slide, just to give you a sense of where enrollees are getting their source of routine care and where they prefer to get their source, we asked, where are you getting regular care? If you had a choice to get care anywhere, where would you want to get it? It pretty much matches. Most enrollees are getting care where they want it. 69% say they're getting routine care at a doctor's office. 25% say they're getting it at a community clinic or public hospital clinic. Where do they want to get it? 77% say at a doctor's office, 17% at a community clinic or public hospital clinic. So in general, enrollees are getting care in their preferred setting. So on the next slide, we asked a number of questions about access to providers and how easy or difficult is it to find providers who accept Medi-Cal. The pie chart on the left is among how easy or difficult is it to find primary care providers or regular doctors. By and large, 79% say it's easy to find a primary care physician who accepts Medi-Cal. So despite trends around reimbursement, still pretty big majority saying that's easy among primary care providers. 18% say it's difficult. There are some groups who are more likely to say it's difficult. Adults are more likely, I'll get to in a second. People with disabilities, people in fair or poor health. But overall, 79% say it's easy. The dentist pie chart, this is among parents of children enrollee because Medi-Cal does not cover non-emergency dental care for adults. We excluded that here. So 72% of parents say it's easy it's easy to find a dentist who will accept Medi-Cal for their child. 21% say it's difficult. So pretty positive findings around primary care providers, dentists for children. On the next slide, here's where we get into a little, some challenges enrollees are facing, and that's around specialists. So how easy or difficult is it to find a specialist who accepts Medi-Cal? 29% of enrollees say it's difficult, 43% say easy, 27% unsure. So that 29%, almost a third are saying that it's difficult to find a specialist who accepts Medi-Cal. And again, certain populations, which I'll get to, are more likely to report difficulty. For example, white non-Latinos, 42% say it's difficult to find a specialist. Those in fair or poor health, 45% of the sickest say it's difficult to find a specialist. When it comes to mental health providers, 46% are not sure. They haven't tried to find one. 32% have tried, say it's easy to find a mental health provider who accepts Medi-Cal. 19% say it's difficult. Of those, we did ask whether the enrollee has been told by a doctor that he or she has depression or anxiety. Among those groups who have been diagnosed with depression and anxiety, 30% say they've had a difficult time finding a health provider. And we have another film about a woman who had some problems around that. So some issues there around specialists and mental health providers. So on the next slide is where I get into so we can compare adults with Medi-Cal to adults in the state with other coverage. So in those two surveys, we asked identical questions so we could compare these two. On this slide is how the percent saying that it was difficult to find a provider who accepts their insurance. So the first set of bar charts is around specialists. So 34% of adults with Medi-Cal say it's been difficult to find a specialist who accepts their insurance, Medi-Cal, compared to 13% of adults in the state with other coverage saying it's difficult. So almost 3 times more likely to say it's harder to find a specialist who accepts their insurance than other adults in the state. When it comes to primary care providers, 23% of adults with Medi-Cal say it's been hard to find a doctor who accepts their insurance compared to 11% of adults with other types of coverage. So again, there's a gap there between adults with Medi-Cal and adults with other. That gap narrows when it comes to mental health providers, 21% of adults with Medi-Cal versus 16% of adults with other coverage have found it difficult to find a provider who accepts their insurance. So in the survey we had, since most Medi-Cal enrollees are children, we had a smaller subgroup of adults. We had about 330 adults in the survey. that these data come from. So we're not able to slice and dice that group of adults to a large extent because of sample size limitations. But on the next slide, we did look at a couple different groups. One is we looked at adults with Medi-Cal in fair or poor health, and we wanted to compare those with adults with other coverage in fair or poor health. You know, maybe the Medi-Cal population is sicker, and that's why they're facing more access issues. So we wanted to compare more apples to apples. So when we looked at these groups, what we found is 47% of adults in Medi-Cal who say they're in fair or poor health have had problems finding a specialist who accepts their insurance, compared to 23% of adults with other types of coverage who are in fair or poor health. Okay, so even when you're looking at health status and being fair and poor, being in poor or being sicker, there's still that gap there in terms of reporting difficulty to find a specialist. We also looked at white non-Latinos because this group really popped in the Medi-Cal enrollee survey as having difficulty. This is a small sample size. This is only 71 cases. Because the difference is so big, it is a statistically significant difference. 46% of white non-Latinos in Medi-Cal report finding it difficult to find a specialist, compared to 11% of white non-Latinos with other types of coverage in the state. And then we looked at income, and that gap narrows. So the 34% is among all Medi-Cal enrollees, so they're all low income. And then we looked at it with adults with other coverage who are at or below 138% of federal poverty level, and that gap narrows a little bit. On the next slide, so we've done a lot of qualitative research, and in fact, leading up to this survey, we did a round of one-on-one interviews with enrollees, and almost every interview, what we heard was really reflective of the data, very positive feelings, a lot of gratitude for the program, positive experiences, except for dental care. Adults were very aware that they no longer qualify for dental care, and that was a big issue. They're putting off care, sometimes for their children as well, who need a lot of care. So in the survey, we asked whether they delayed dental care due to cost. 55% of adults say yes. They have put dental care off in the past year because of cost. For their children, less so, only 20% say they've delayed dental care because of cost. And then last night I was curious, so I was looking at the data because adults with Medi-Cal are more likely to use the emergency room than adults with other types of coverage. There's a pretty big gap that's in the study. So I looked at that 55% who's been delaying dental care, are they more likely to use the ER than those who have put off dental care? And they are. So of those who put off dental care, half have used the ER in the last year. Of those who have not put off dental care, so who have gotten the dental care they need, 32% have used the ER. So there's an 18-point difference there. I'm not saying it's causation, but there is that difference there. So an important thing that in terms of access is coming up. Okay, so on the next set of slides, subgroup differences. So we looked at different populations. We looked across the survey, and 4 different subpopulations came up over and over again. I'm going to show you a little bit, one piece of data for each of these groups, but know that we're singling out these groups because they emerge over and over as either faring better or worse than others. So on the first one is language, race, and ethnicity. And what's interesting is, this is one of the groups that really we see differences throughout the questions. Spanish-speaking Latinos, which by the way is about 1/3 of the sample, Spanish-speaking Latinos are much more positive, they're more enthusiastic, they are much more likely to say the program is awesome, they are much more likely to report very, very positive enrollment experiences. They're less likely to say they have issues around access. So that comes up over and over again. The set of bar charts the bar charts on the left, this is the percent reporting difficulty finding a primary care physician who accepts Medi-Cal. So 9% of Spanish-speaking Latinos say it's been hard to find a doctor, primary care doctor, versus twice as many English-speaking Latinos, 20% of African Americans, 32% of white non-Latinos, 14% of Asian Pacific Islanders. But this is reflective of, as I said, questions throughout. As a FYI, Spanish-speaking Latinos are much more likely than others to say their regular place for medical care is a community clinic or public hospital clinic. That's the set of bar charts on the right. So 39% of Latinos, Spanish-speaking Latinos say that's the place for routine care, compared to just 18% of English-speaking Latinos and about the same proportion of other groups. Let's go to the next one. Another set of differences we see throughout the data are adult enrollees versus child enrollees. So we obviously interviewed the parents of children. So throughout the data, we see that adults tend to fare a little bit worse, have a little bit more negative views toward the program, and experiences with Medi-Cal. This particular question we're looking at is among people who among enrollees who needed to see a specialist or who needed to see a primary care physician, and how hard it was to get an appointment when they needed one. So the first one is 42% of adults who needed to see a specialist say it was hard to get an appointment when they needed one, compared to 25% of children who needed to see a specialist. Only 25% of children say, or their parents say, it was difficult to get that appointment. So access to appointments, there's that difference between adult and children. Same with primary care providers. So 26% of adults had a problem getting an appointment with a primary care doctor when they needed to, compared to 15% of children. And again, this comes up in other questions, perceptions about whether Medi-Cal covers the care people need, and whether they, problems finding a specialist who accepts Medi-Cal. We see those differences among adults and children. On the next slide, another set of differences that emerges among those who have a disability versus those who do not. So those with a disability, again, kind of fare a little bit worse, have a little bit more negative views toward the program, a little bit more negative experiences. So on the question about whether, this is the attitudinal question, does Medi-Cal provide access to high-quality care? 30% of enrollees with a disability disagree with that, essentially saying no, it doesn't have access to high-quality care, compared to 19% of other enrollees who don't have a disability. Overall, still 57% of people with a disability agree that the program has access to high-quality care. So it's still positive overall, but more likely to disagree, more likely to have a little bit more negative experiences than others. And then the final set of subgroups that emerges over and over again is health status. And this was based on just the standard self-reported health status. What we're looking at here is, again, of those who needed to see a specialist, how was it difficult getting an appointment when you needed to? So all of these needed to see a specialist, okay? 46% of those in fair or poor health said it was difficult to get that appointment when they needed it, compared to 23% of those in excellent health who needed to see a specialist. So it may be, perhaps those in fair or poor health are seeing more specialists, and then, your chances increase for having a hard time getting an appointment. Not sure, but there are these differences. And again, it comes up over and over again. The sickest enrollees tend to have some more difficult experiences. So that poses a challenge in terms of making sure everyone gets the access and care they need. So the final set of findings I'll go through is around newly eligible adults. So this was in the statewide survey we did last May. This survey was about 30 minutes long, by the way. It was on a number of different topics. If you haven't seen it, it's on the website, the foundation's website. It was a really great survey. We were also able to look at different, I'm reporting right now under at or below 138 federal poverty level, but we could look at different federal poverty level groups, and there's some exchange-related information there, and perceptions of quality, and a lot of good findings there. Okay, so among the newly eligible, we wanted to ask questions around sort of the standard, typical, common barriers to enrollment. These tend to be perceptions of ineligibility. So I don't apply. I know I'm not going to be eligible for Medi-Cal, so I'm not going to sign up. Another is not knowing how to apply for Medi-Cal. Another is thinking that the application process is really onerous. So we asked these among the newly eligible population. By the way, we took out people who have Medi-Cal. So these are people not in Medi-Cal, but who will be, or at least representative of those we think will be eligible in 2014. So we did find some raise some potential flags for an awareness campaign in the next year and a half. 27% say they would probably qualify for Medi-Cal. So almost 3/4 say they're not sure or say they won't qualify for Medi-Cal. About 2/3 say they don't know how to apply for Medi-Cal. So that's going to be a challenge, getting the word out on how to apply for Medi-Cal. And about 2/3 say they think the Medi-Cal process would be hard or aren't sure. So again, it speaks to that barrier. And now we know that the enrollment process for most enrollees is pretty easy. They report it pretty easy. So that's some education that needs to be done. On the next slide, we looked at preferences for enrollment. And here we just showed a couple different income groups. The darker bar is the at or below 138, so the newly eligible population. Kind of what we saw with enrollees. They want a variety of different methods to enroll. So 31% would want to enroll at a county government office, 20% by mail or telephone, 19% online, 14% at a doctor's office or clinic, 13% at a community organization. As you go up in income, you're more likely to want to enroll online. As you can see, that's the 40% of those in the 139 to 250 want to enroll online. And just as an aside, well, I'll get to that in the next slide. So a mix of enrollment methods are preferred by the newly eligible population. On the next slide, we did ask in this survey some questions related to the exchange, some questions related to online enrollment. How comfortable would you be applying for insurance online? A sizable proportion, 41% of the newly eligible and 42% of current enrollees say they're not comfortable. So a little bit more than half are comfortable, a little bit fewer than half are not comfortable. And part of that not being comfortable, it's not just an access issue. When we looked at Medi-Cal enrollees who use the internet at home, and that's 56%, by the way, of Medi-Cal enrollees use the internet at home, 34% still say they wouldn't be comfortable enrolling online. And I think what we've heard from qualitative research is they really want, so oftentimes they're sick, they need coverage right away, they've been delaying care, and they're afraid that they're going to screw up online or they're not going to answer questions right. They want somebody telling them, yes, you did everything right, you handed in the right information, you're going to get a card in 2 weeks, those kinds of things. And that's some of the anxiety, I think, in my view, of why there's a little bit of hesitation around enrolling online, although over half are comfortable. So I think those are the key findings. There's a snapshot of findings in your folder. This was a snapshot of the snapshot. There's a lot of data here. There are a lot of numbers online, a lot of crosstabs. But I think these are the key findings. I mean, overall, again, very positive. Couple areas for improvement, especially around access to specialists. The dental care issue, not sure. We can address that, but issues around specialists, and then I think some interesting insight, newly eligible, and how communications need to reach them, and some insights into what potential barriers might be to enrollment. There we go. Hand it back to Jamie.
And I'm going to turn it over to our reactors. Like Chris said, I don't think they need much of an introduction, but we are lucky to have Elizabeth Landsberg here, Director of Legislative Advocacy for the Western Center on Law and Poverty, and Len Pinocchio, who used to work for the foundation, but is now the Associate Director for the California Department of Health Care Services.
Elizabeth. Great. Well, I wanted to start out by thanking the foundation and Tresa and her folks for doing the study. I think many of us who work in health policy have assumptions about how Medi-Cal works, but what I think is so important about this is to hear from those served directly by the program about how the program works for them. And I particularly appreciate that we're actually directly hearing from some of the beneficiaries. So kudos to the foundation for putting those videos together, and you should look at the other ones online, and I'll refer to at least one of them, because I think she had some important insights. So I really appreciate that this study gives us an opportunity to hear directly from the folks served by the Medi-Cal program. And overall, I'd say we're very gratified to hear that Medi-Cal in general gets an A-, overall perception being 90%. So that's really favorable. And so I think as we look to health reform and some of the assumptions some of us have about how Medi-Cal is going to interact with the exchange and with healthy families, it's helpful to know that people hold such a positive view of the program. Turning to quality of care and benefits, you know, we are concerned with some of the findings. The findings are that, not surprisingly, that Medi-Cal does a little bit less well in terms of what is covered and on the quality of service. 78% of beneficiaries think it covers what most people need. As Chris referred to, we did enact 10 optional benefit cuts in 2009, including dental, podiatry, psychiatric services, and others. And not surprisingly, we're seeing real impacts. And there are many voices that we're not hearing from of people who have lost teeth and who have suffered worse health consequences because of those cut benefits. And then only 69% agree that they're getting access to high quality care. So certainly something that we need to strive to improve is the quality of care side. In terms of enrollment, again, we're pretty gratified to see that about 3/4 think that signing up for Medi-Cal is easy. I am surprised by that. We've often joked that we would like to make members of the legislature fill out a Medi-Cal application so they can see what it's like and all the paperwork requirements, because I think for a lot of folks it isn't easy. We have too many paperwork requirements. The good news is we'll be simplifying that thanks to the Affordable Care Act. We will have to get rid of the assets test for most people. We will not have paperwork for most people thanks to some of the verification systems. So I think, you know, the rules are too complicated now. We will be simplifying them, but it's good to know we're starting from actually not such a bad place, so that we'll be able to simplify it a lot more with a single application for Medi-Cal Healthy Families and the exchange. We are concerned with the finding about long wait times at county offices, but I think it's important to remember that's in the context of the last couple of years when we've seen an unprecedented number of people applying for Medi-Cal for the first time with the recession. So it is at a time when we have a lot of folks newly applying for Medi-Cal that the county offices have been overwhelmed. I think it's striking and important as we look to health reform implementation that half of respondents actually want to continue to apply in person, either at a county office, and even more want to be able to apply at their doctor's office or a community organization. So there's been a lot of focus with health reform implementation on the online application, and we share the goal of having a very simple online application. But as we work for that goal, we need to remember that a lot of people need help. A lot of people do want to be able to apply in person at a county welfare office with a community-based organization or at their doctor's office or clinic. And that even those who apply online are going to need help. In terms of access to care, it's great to see, I don't think this is a slide that Tresa showed, but 94% of respondents on Medi-Cal have a usual source of care. And of course, that's a fundamental underpinning to getting preventive care, to getting care coordination, is to have a usual source of care. So we're happy to see that. The flip side is that there are more Medi-Cal consumers using the emergency room than people with commercial coverage. And we're concerned about how hard it is for Medi-Cal consumers to find a doctor, especially specialists. I think we all know that due to fiscal pressures, the Medi-Cal program has suffered cutbacks, including on provider rates, and we're seeing the results of that with some of the access problems. The access problems are particularly acute for people with disabilities and those in poor health who, of course, need the care and services the most. So I think we need to pay special attention to those findings and access problems there. On the other hand, we heard from Thera and the dad with with a profoundly deaf daughter that the Medi-Cal program was meeting a lot of her needs. And I think it's important to remember that the Medi-Cal population the Medi-Cal program is serving an awful lot of children and adults with special needs. So there's sort of a disproportionate burden put on the program. Several of the folks on Medi-Cal talk about problems finding a doctor. One of the videos you haven't seen, but I encourage you to look at, is a woman named Sky, who has both mental health and medical conditions that she's challenged by. And she talks very articulately about wanting more education about her conditions, wanting more preventive care, and wanting better integration between her mental health services and her physical health services. And so I think it's a challenge to the program to continue to improve the delivery system, to improve the integration of care. The department, I think, has focused primarily in delivery system reform by putting more Medi-Cal consumers into managed care plans, but that doesn't necessarily come with healthcare homes and care management. One of the slides that wasn't focused on, but is in your snapshot as opposed to your snapshot, is slide 22 that looks at the different experiences of fee-for-service versus managed care folks. And there you can see, I think it's disturbing that there are significant access to care problems identified with health plan enrollees as well as fee-for-service consumers. And in fact, there's a slight increase, slightly more managed care enrollees had trouble getting a primary care physician than fee-for-service enrollees. So we really think it's not acceptable. The assumption is that if you're in an HMO, you can at least get a PCP. So we really encourage increased oversight by DMHC and DHCS on the managed care plans to make sure that these delivery system challenges are met. I'm happy to see DMHC folks here in the room. And then last, in terms of ACA implementation, we're really appreciative that the survey also include talking to folks who will be eligible for Medi-Cal. It shows a great need for education about what the program covers and about the need for education and outreach. So a lot of them want in-person assistance. The exchange, DHCS and Mr. Mib are working on a joint outreach strategy, and that's just going to be critical in reaching this population. So as Chris said, today 1 in 5 Californians are on Medi-Cal. With ACA implementation, 1/4 of our state's population will have Medi-Cal. So Medi-Cal is in many ways the backbone of health reform implementation, and I would say it's both a strong foundation upon which to build, but also one that we need to continue to try to improve to fund adequately, both for health reform to succeed and, frankly, for the state's healthcare system to succeed. Thank you.
Good afternoon, everyone. Thanks for coming. And thanks to Chris and to Tresa for the great work. Very appreciative. We see this as a really important study and one that is a tool among many that we have to understand how our beneficiaries get service, how they fare in the program, and what they actually say about it, rather than just looking at static, cold numbers. So thanks, and Chris and I have been chatting about, when would we do this again? It's very valuable, and hope we can do it. There's lots of data, of course, so you've just seen a small snapshot of what's in there. So a number of us at the department have the full set of crosstabs with lots of sticky notes all over it, and we'll be continuing to mine it for a long time to get more insights. First of all, really happy and gratified and frankly proud that this program works as well as it does, given the complexities of the population, the policy nuances, all the budget issues, and that we've added so many beneficiaries over the past couple of years due to the poor economy. And so in hearing so often, oh, we were so surprised, we were so surprised, we were so surprised. In many ways, we were too. I think the goal for us is to not be surprised. All right, so the next time we do this, wow, that's exactly what we expected it to be. So that's my challenge for us and to all of you who participate in some way in giving this program some shape. At the same time, resolved to make it better than it is. So we have a proportion of beneficiaries, in some cases a large proportion of beneficiaries, those who need care the most and the most quickly are having difficulty finding care. And as many of you in the room knows, it's a very challenging problem. Budget constraints, I don't need to go into the long list, but it is something that we're resolved to do the very best we can to improve care for those folks. I think another, not entirely surprising, but some surprise in it, because it goes against some of the narrative you hear, is that beneficiaries in managed care, on average, actually have better experiences than those in fee-for-service on many measures, right? So more favorable perceptions of Medi-Cal overall, so Medi-Cal managed care beneficiaries report that it covers care, more likely to report that it covers care that people need, provides access to high-quality services, and the managed care enrollees are less likely to delay care for specific medical problems, so on average. Better alternate access for those who are enrolled in a managed care plan, so phone number to call, access to urgent care, evening and same-day appointments, and also less likely to use the emergency room. So it works well, not for everyone, but on average works well. And so I think, and in particular, seeing these numbers, Medi-Cal works well for kids, which is a really important population to us. And so as we consider moving Healthy Families kids into Medi-Cal, some contentment that it will work well for them. So as Elizabeth shared, and we're doing a lot of work together on preparing for the implementation of the Affordable Care Act. Actually, we're deep in it already. And this is where, for us, it becomes very challenging to put on the I'm excited about the Affordable Care Act and all the work we're doing to expand Medi-Cal and work in partnership with the exchange on how we're going to do enrollment, cover millions more people, and then the day-to-day, how do we manage a very big, complicated program every day while we're thinking about expansion. So it was surprising to hear that the enrollment works as easily as it does for many people. What I read into that is that makes me content and happy that it works well. And for 2014, people definitely want options. They want to be able to do it in person when they need to, do it online, send it in by mail, pick up the phone and call somebody. So our expectation is the enrollment process overall will be much easier, and even for mixed eligibility families, right? So you're going to have parents in the exchange, kids in Medi-Cal. So the way we're thinking about the enrollment process is that even a family with challenging eligibility status will get full service and be able to enroll where they belong. Another surprise for us was that it worked so well for Spanish-speaking beneficiaries. And again, looking to the future, with about 40% of the newly eligibles who will be coming to Medi-Cal are Latino. This bodes well for them, that the program serves them well, their needs are being met. So for current beneficiaries who are Spanish-speaking, they have an easier time finding primary care providers, dentists, and specialists, access to evening appointments. They found it easier to sign up, and less difficulty overall getting appointments. So given that's nearly half of our incoming beneficiaries, feel well prepared to greet them. Another thing that I wanted to give a kudos to all of our providers is that on average, Medi-Cal beneficiaries have better access than others with other coverage to evening and weekend appointments. So I wish I had access to evening and weekend appointments. So, and I think I'll just close by saying, and again, I think this runs counter to what is so often a national narrative, and that is that government can work well, particularly for the most vulnerable in our state. So given how challenging it is with our budget, that we've added so many new beneficiaries and are working diligently to do the best we can for who we have now and those who will be coming in 2014, we're doing a good job. We can do better, and we'll rely on the foundation and our advocacy partners and all of you in the room to help us stay on task to do that.
Before we open it up for Q&A, we do have one more video to show you, and it's one that Elizabeth mentioned, actually, featuring a woman named Sky. And she's a woman on disability with kidney issues, sciatica, and mental health issues. And we'll see her story.
I live in Fresno, California. I live with my boyfriend of 6 years and my cousin and his girlfriend. I have been on disability for about 10 years now. Currently, I have asthma, anxiety, depression, sciatica, and nephritis, which is a kidney condition. I qualified for Medi-Cal when I got disability because I had a lot of mental problems and I tried to commit suicide. I have faced a lot of challenges with Medi-Cal, a lot of it having to do with mental health. The experience of trying to find the help that I needed myself delayed the medical help that I needed, the therapy that I needed. It's also the prescriptions that you need aren't always available. You have to get TAR forms or wait for them, or so much needs approval and red tape to go through that it's just difficult to get anything done. There are so many things that I think would make Medi-Cal more effective. One is preventative services. If I have a problem or an issue with my kidneys, telling me how to take care of it, or nutritional classes for my weight. The second thing that they could do to change and make Medi-Cal better would have the doctors not be drug dealers. You tell them the problem and they get out their prescription pad, and that's not always where I want to go first. The last would just be make services more available to people, let them know what's out there for them, and have things like coping classes, have things that help you rehabilitate yourself if you're able to. If I had a medical team that focused on my care for both mental and physical health, I think that would be awesome, because I think the way that you need to fix people is through preventative care.
All right, we're at the Q&A portion of this event. So questions, comments? I do see someone up here, Laura, in the second row, and then the first row. Thanks.
You didn't present any findings relative to geographic regions and distinctions, and I'm curious what you found in that regard.
We did hope to present findings by geographic region. The data, due to privacy restrictions, the data that we received at this point from the department has, we're unable to do that, essentially. That we have the first 3 digits of zip code, and it's very hard to then stratify by anything meaningful. So we hope to go back to the data to present some of that information, but we don't have anything yet that allows us to do that.
Is there someone in the front? Yeah. Oh. She'll bring the microphone over for you. Jamie, ask the same. Oh, can you also state who you are, name and where you're from?
Yeah, I'm Drew Bruschetti with Maxim Healthcare Services. We provide in-home nursing care for medically fragile patients. My question was, is there plans to extend this research, the access to care research, to other services like durable medical equipment or home health for those participants?
That's a great question, and I would ask, I'll write that down, but if any of you have suggestions about other types of questions you'd like us to ask in future surveys, we'd be happy to hear them. I will say, given the response to this survey, I'm hopeful and confident that we'll conduct the survey again, particularly given Len's comment earlier that they'd like to work with us to do so again. So I'm hopeful that we'll do another survey. We don't have any specific plans or timeline to do that, but we would be very interested in your ideas and suggestions for questions to include.
Thanks. Frank Newhouser, University of California, Berkeley. 2 questions. This data is so much fun that it leaves me with more questions than answers. And one of the things, I think Chris mentioned that you did a survey 12 years ago. Are those data available? I mean, the results of that survey, so we could compare it to this one? And then the second question would be, are you going to make these data available to researchers to look at as well, the individual data?
So the first question, we worked with Lake Researchers Partners on the survey 12 years ago. Unfortunately, the sampling design was a little different, so we were reluctant to compare the results across the 2 different surveys. There were some interesting similarities and differences. So the overall perception that Medi-Cal provides value is something that wasn't surprising to those of us who were familiar with the survey 12 years ago, because something that we heard back in that survey. The enrollment experience seemed to be different this time around. But as I said, it was a different sampling frame. So the last survey included, for example, people over age 65. And there were some other differences as well. So we chose not to compare them, this survey to the last survey. But that survey is available. The report from that survey is available online. It's called Speaking Out. If you went to our website, chcf.org, and searched Speaking Out, I think you would find the results to that survey. In terms of making the data available, as I said in my opening remarks, the crosstabs are available. So I think if you haven't already seen them, if you haven't been to the website this morning, I would look there first, because I think they provide a wealth of information. The individual level data is not even available. Was it even available to you?
It's available to us. I don't think it's available to
Yeah, it's not available to us, and I think you would have to, you'd probably have to work with somebody in the department to request that data, because we don't have the right to share it.
Hi. Hi, I'm Joy Melnico from University of California, Davis. I had a couple questions about, a little bit more about the methods of the survey. So I know for some people that might be a little dry, but what was the response rate among the Medi-Cal recipients, and how representative were the respondents by gender, age, race, ethnicity, region of the state? And you said that you weren't able to do comparisons regionally. Are you able to look at urban versus rural, or any kind of, California is such a huge state. Are there any questions there that you may be able to answer?
Okay, I haven't gotten the question about response rates in like 6 years. However, the response rate was 35%. Which may sound low, but it is actually nowadays, for a telephone survey, that is a pretty decent response rate. In fact, it's higher than what Pew Charitable Trust, for example, tends to be higher than what they get. Gets to be on par with what the Washington Post gets. In terms of representativeness, yes, we were able to get. What we did when we pulled the sample, we got counts of the universe, so by age of enrollee, by race, by language spoken. So we could see what percentage of the universe, of the under 65 that we wanted to look at by these demographics. And then when we got the unweighted data back, we compared those demographic characteristics, and they were very close. We're a little bit over on Spanish speakers, a little bit over on Latinos. We weighted those to be in proportion, but maybe 5 percentage points, something like that, over. So it came in fairly representative of the universe we are studying. In terms of geography, as Chris mentioned, because of privacy issues and policies in place, the only thing we could get is the first 3 digits of the zip code. So we were able to look at the universe by first 3 digits to make sure that that matched what we got in terms of interviews, but we haven't figured out a way to, how do we group those in terms of meaningful regions in the state? How do we group those in terms of meaningful urban, suburban, rural areas? We haven't done. It might be something further we can study.
Yeah, and I would just add that I think this, this type of feedback is exactly the kind of encouragement we need to perhaps go back to the department and see if we can work with them to get some of that information so we can further examine some of those differences. I think we set out to do that, and it wasn't until we realized what we had that we couldn't do, in particular the urban-rural differences, which you think would be at a minimum to be able to do some of those. So I hope that we can explore those further.
Thank you. I'm Darian DeLue with the California Department of Alcohol and Drug Programs. I had a couple of detailed questions. On the first snapshot, I was a little mystified as to the difference between page 17, where it talks about 29% found it difficult to access specialists, But then on the next page, it jumps up to, or is the next page? Yes, 34% found it difficult to access specialists. Now, the first kind were specialists who would accept Medi-Cal. I would assume the second kind were also specialists who accept Medi-Cal. So can you elaborate on that?
Sure, and that is a little bit confusing. So the first one, the 29%, is among all enrollees, so adults and children. And then the second one is just among adult enrollees, 34% had difficulty.
Thank you. And then...
And the reason the second one only includes adults is because the general population survey was only among adults, so we could only compare adults to adults.
The other question is not something your survey would tell you, but I wondered if general knowledge gives you any insight into why the Spanish-speaking Latinos were so much more positive than the non-Spanish-speaking.
That's a really great question. I can only hypothesize. I think they're also more likely to use community clinic. I think they're better staffed with bilingual physicians, nurses, community health workers. So I think they feel more welcome and they get better services in community clinics.
Yeah, I would agree. It's great kudos to the county welfare offices that have Spanish-speaking, have such great Spanish-speaking staff, and to the community clinics that obviously are doing a good job serving that population. So it's a great finding to see.
I think, somebody made the comment earlier that this kind of data, and in fact most data that one collects, often raises as many questions as it answers, and I think this is certainly one of them. We don't know, for example, whether or not Spanish-speaking Latinos are more likely to respond in positive ways to any variety of questions. That could be one. It could be that they have a different sort of baseline of experience against which they're comparing. It could be that they have it could be that they have different experiences, and perhaps the fact that they are more likely to use community health centers, public hospitals, could be one reason. We don't know that that's causal. We don't want to make that statement, but there's a variety of possibilities, and unfortunately we can't answer that, but it's certainly something that's worth looking into further.
Hi, Carol Rogers, Department of Healthcare Services, and I'm in the third-party liability division. And in moving forward, Tresa, this is for you, because one of the issues that I'm always faced with is trying to provide an online service to our Medi-Cal recipients. And when you alluded to sometimes people did not feel comfortable because they didn't feel well when they were doing the application, or there may be other factors, did you find any additional insight as to how to improve online services for Medi-Cal beneficiaries?
Yeah, that wasn't something that we really explored in this survey. We did another study recently last year that the foundation funded, as well as California Endowment, that looked at different enrollment methods. And so we actually assigned people who are eligible for Medi-Cal, we assigned them, you have to go enroll online. And one e-app and a number of different forms. You have to enroll by telephone. You have to enroll by county office. And then we did interviews. We had them keep notes, and then we did interviews with them afterward. And I think the main thing with the online, one key thing is at the end of the process that we found people weren't sure what would happen next. They weren't sure, they clicked whatever, I forget the final thing is, submit or whatever. Do I have health insurance now? What's going to happen next? Where did all my data go? So having very clear next steps and congratulations, or whatever the words are, that you have finished, you have given us the information you need. People are really concerned that they answered questions, they might have answered questions wrong. So if there's some kind of way to check that, or at least give them assurance that, if we have questions, we will call you, or whatever the next step is. So there's a lot around, I think, closure that's really important, and to have help available, and that clearly on the website is key. Does that help answer?
I would just add, and maybe Len may want to as well because he's worked on this, but we've been working on online enrollment for about 12 to 15 years, and the model that we have described from the outset was really the TurboTax model. And so there's online enrollment where you fill out a paper form online and submit it, and that's online enrollment. And then there's, I don't know how many of you use TurboTax or something similar, but there's error checking. There is, it communicates with often with your banks or your payroll department. You submit it and it tells you whether or not it's been accepted. It tells you how far you are to completion. It tells you that you'll be notified whether it's been accepted within 24 hours. So, so online enrollment is not online enrollment, and that is clearly the kind of the gold standard with which we seek to help move California and on our work nationally.
And I'll just add that, as I was saying earlier, how we're excited about what enrollment will look like for the future. So this is an opportunity to take the online opportunity and make it much, much better. So the current online applications, as Chris was saying, don't really work very well. They're not very consumer friendly. In fact, a project that the foundation is funding called the User Experience 2014 project that's being designed by IDEO, which is a design firm in Palo Alto that designed the mouse. They have been working for about over a year now on what the TurboTax model of online enrollment will actually look like from the consumer's perspective with the, you can tap on a button for, quick chat with an expert. It shows you how far along the process you are, answers a lot of difficult questions about eligibility, and makes it a much more consumer-friendly approach than has been done in the past.
Hi there, Anthony Wright with Health Access California. I very much appreciate the report and the results and the rigor which with it was done. I guess two questions about just get comments on any potential influences by the type of population that was surveyed. Number one, on enrollment, is there any potential bias in the fact that these were all people who were in Medi-Cal, so maybe the people who found it very difficult to enroll and aren't enrolled? There's an impact of, those who got in are the ones who actually succeeded. Mm-hmm. So they're probably the ones who think it's probably easier than others who didn't get in. And number two is, if there is, with regard to the question of the health status of the enrollees, because I know in sort of the general HMO surveys, people feel very good about their coverage when it's a card in their pocket. The question is what happens when they actually encounter the medical system. And I know that there was a metric about fair or poor health, but was there any attempt at trying to do something more specific about like numbers of medical encounters? Because that would be the actual the test of engagement, because people actually don't have a very good sense of whether they are healthy or, they're all over the map about whether they think they're in fair health or good health. We both think of ourselves both not as healthy as we are in some instances, and probably healthier than we think we are in others. So I would just be curious if you have some thoughts about how to get more precise in that regard.
Oh, so while Tresa is stalling, first, a couple of things. First, I have to thank Anthony for taking calls from reporters as they were producing their stories on this program. Even without seeing the results in advance. You make an excellent point on your first point, which is we were surveying people who are enrolled in the program, and people who are eligible but not enrolled may have a different perception or experience with the enrollment process. So that's an excellent point. I'm glad you made it. We do have some the results of the people who are from the general population survey. What we're calling newly enrolled are people below, with incomes below 138% of the federal poverty level who aren't enrolled in Medi-Cal. So we think most of them will become newly eligible. Some of them won't because of the rules, and in fact, some of them may already be eligible but not enrolled. So those results do provide some indication of people's at least awareness of the Medi-Cal and their perceptions of the Medi-Cal. We didn't ask them about their experience enrolling because they weren't enrolled in Medi-Cal, and we just didn't know. We figured too few of them probably had tried to get any valuable results. But that's an excellent point. And now the second.
You've stalled enough. That's great. Okay. Yeah, we did ask number of doctor visits, and we asked emergency room visits, and then we asked about, again, I think I mentioned, has a doctor told you had a depression or anxiety? We have that measure. And then we have, do you have any ongoing medical chronic conditions that need regular care? So we have those measures. In terms of doctor visits, yes, the more doctor visits, the more likely you are to say it's difficult to find a specialist. For example, although there may be some bias in that because people are, who need to see a specialist are also the ones who have a hardest time finding it. The same is true with ongoing, those who say they have chronic conditions. For example, 37% say they've had difficulty seeing a specialist versus 25% of those who say they don't have ongoing medical issues. But the self-perceived health status is a little bit higher. So those who perceive themselves in fair or poor health are a little bit more likely than those with several doctor visits to say they have problems. So.
You might have said this early on, and I apologize. Did you talk about aid groups? Like, are we talking SSI or AFDC family groups only in your survey? And if there's a combination, do you distinguish in any of your findings? Because obviously SSI is chronically ill.
Yeah, we did. As Tresa said, we did draw a representative sample of the Medi-Cal population, excluding those who I mentioned, people who have Medicare coverage, people who are elderly, and people who, for those of you who are, I won't try to explain it here, but those of you who have share of cost Medi-Cal, if they had met their share of cost, they were certified eligibles, they were included. If they hadn't met their share of cost, they weren't actually getting benefits at the time, they weren't included in the survey. But among those, among those who were included in the survey, it was a representative sample, and we did have aid code groupings, and so we in the way the data, at least that I saw, I'm not sure if you had, I think we had sort of what DHCS categorizes as major aid groupings. So we had medically needy families, medically needy disabled. We had public assistance families, public assistance disabled. We had, 4 or 5 other different groupings. And then, for the purposes of this presentation chart book, we just grouped them into the 2. But we do have it at another level of detail.
It's in the Crossroads on the website.
Yes.
Thank you. I'm Ernesto Sanchez with the Managed Risk Medical Insurance Board. My question is a little more on the micro level. Jolena, one of your vignettes talked about the family with share of cost, and I'm just hoping that somebody talked to her about that her kids are probably eligible for the Healthy Families Program, and that we wouldn't want her waiting till her share of cost kicked in. So if you haven't, would be happy to have somebody reach out to her family and enroll her in the Healthy Families Program.
We had the same thought over here, so it sounds like you're in touch with her, and we should make sure, they should be eligible for Healthy Families.
And, they may be. I would have to listen to her. I've listened to her. I've watched that video several times. But now that you mention it, as I recall the conversation, the original conversation with her, she was talking a lot about the challenges that her husband faces getting care because of his share of cost. It may very well be that her children, their children, are in Healthy Families. But I have to watch the video again. That's a good question, and we are in touch with her, and if that's not the case, we certainly will. I will say that if any of you have participated in these one-on-one interviews, so we did the telephone survey, and that's the reports that Tresa presented, but in helping to inform that survey design, we conducted interviews with people who self-identified as Medi-Cal enrollees, and from them, we identified a few of them to invite to present their stories on videos. And they're heartwarming, heart-wrenching, really interesting stories with so many takeaways from them. I'm sorry that we were only able to provide sort of a snapshot in the 4 that we have. But one of the things that we did find is a lot of misinformation about what coverage they had. People that said they were on Medi-Cal, turns out they were on Healthy San Francisco, for example, or maybe they were on Healthy Families. People who had Kaiser were on Medi-Cal, thought they had private coverage. People who had a number of different misperceptions about the Medi-Cal program, what they were eligible for, what they weren't. So there's a lot of, in addition to the areas where we've identified opportunities for awareness and education, there are many more.
You mentioned when you Sarah Scher from Community Clinic Consortium. We represent community health centers in Contra Costa and Solano counties. You have mentioned a couple of times about a Medi-Cal awareness campaign, especially regarding newly eligibles. Is this something that is being rolled out, and are there plans to partner with community health centers and county hospitals to increase awareness and outreach and recruitment around Medi-Cal?
Yes, so the Health Benefits Exchange, in collaboration with Mr. Mibb, with the department, and with many community organizations, has put out an outreach and marketing plan, including a navigator's plan that's on their website. I think they released it about 2 weeks ago, and are still soliciting input. So we'll absolutely need your partnership for when that starts to roll out. So it's 150 pages, so happy reading.
And there's a separate report that talks about assisters, both the paid navigators and direct benefit assisters, and how community clinics will play a role in that. The Exchange Board, DHCS, and Mr. Mibb are soliciting comments. Today is the official deadline, but I'm sure they'll take suggestions after that as well.
Hi, I'm Kirk Feely with the Senate Republican Fiscal Office, and I have a question about the delays in care due to cost. It seems like there's kind of a disconnection, depending on the type of research you look at on this issue. For instance, you see percentages about people delay care due to cost in surveys that talk to the recipients. If you look at data on consumer spending from places like the Census Bureau, you see data indicating that even people in the lowest quintile of income spend a significant amount of money on things that I think a lot of people would agree are non-essentials. The data that seems to come to mind is from a couple years ago, people in the lowest 20th percentile spent over $100 a month on entertainment, alcohol, and tobacco, and yet when you see percentages on people delay care due to cost, you see higher percentages. And I don't know how to mesh those two styles of research. Is there any thoughts from the panelists on how we get a better sense of how much of cost is perception versus, personal financial management, which we know is a problem for a lot of people across income spectrums?
I think what's coming to mind as I think about that is just some of the interviews we did, the one-on-one interviews, and I think there just isn't, for example, with dental care and other costs, they're just, I remember one man has like an 8-year-old kid who is missing, he only had one front tooth. Well, the procedure for that is a couple $1,000s. Well, they don't have, there's just not, at the end of the month, there's just not, they can only put away $25 a month. I'm thinking about another participant who had 5 kids, and she's been raising them on her own for 10 years and just lost a job in the recession, lost her home. There's just, her son has a condition, she can't get surgery for him. He has to wear pull-ups that cost $120 a month. That's a tenth of her income. You know, I just don't think there's a lot of expendable income for healthcare. And I think we see that, you know, we see that particularly among low-income populations, but also across the board. I don't know that we haven't really asked, you know, how much do you spend on, do you have cable, do you have, you know, cell phones? We do hear in qualitative research that people are, you know, cutting back on those things. But yeah, it's not something we've studied in detail.
Yeah, it's an interesting question when you get into, as economists, put the basket of goods that people make preferences about when they purchase. And I suppose you could add to alcohol and cable TV, rent, school, daycare, and food.
So looking at the time, we do want to show an additional video, but if there are other questions or comments that come to mind, please feel free to reach out to us at the foundation, and we'd be happy to respond in kind, and I'm sure folks up here would too. So the next video features Holly Mitchell, who is the chair of the Assembly's Budget Subcommittee on Health and Human Services, and she's a longtime advocate for low-income health coverage. She discusses the challenges facing the STRAIN program and the opportunities ahead under healthcare reform.
Since becoming a member of the state legislature, I think my service on the Assembly Health Committee, but primarily my service as chair of the Budget Subcommittee on Health and Human Services, I think is really where I've spent a great deal of time over the past 18 months, focusing on protecting access to publicly funded healthcare services in California. I think the primary issues confronting Medi-Cal in California is the fact that California is broke. Looking at the last about 10 years of efforts of the legislature and the administration to balance an unbalanceable budget, and the areas that have taken a major hit, and Medi-Cal is one of those areas. So I think the primary issue is years and years of compounded impact of budget cuts that have impacted the kind of core infrastructure of the Medi-Cal program. The provider community has experienced multiple years of rate reduction that, from my perspective, impacts access to care, because it's almost not a wise business decision for a healthcare provider to be a Medi-Cal provider, just given the reduction in the reimbursement rates. On the beneficiary side, just the reduction of services, from dental services to the actions we took last March, limiting the number of visits to your Medi-Cal provider, are just two examples of major cuts that the program has suffered in recent history. As reflected in the Medi-Cal beneficiary survey, respondents expressed concern about their ability to access, particularly in a timely manner, specialty care. And so it's my hope with the full implementation of ACA here in California that Medi-Cal will be reinforced and shored up, if you will, in terms of expanding the Medi-Cal provider network to include, of course, the ever-needed primary care physician, as well as all the specialty docs that beneficiaries require. I think setting very public goals, creating a dashboard that measures success will help all of us with oversight, the legislature, the Director of Department of Health Services, the administration, the Health Benefits Exchange Board, everyone to have really a clear idea about the efficiency, the efficacy of the program. Again, really working towards creating healthier Californians, not looking at Medi-Cal as a program that people utilize when they're sick, but to really kind of flip that and recognize that increased access to preventive health services, which low-income and formerly uninsured people will do when they have coverage, really creates a healthier, more sustainable state, and really in the long run will be much more cost-effective for us to operate. And so I think the incredible opportunity we have here in California is to recognize the benefit ACA brings to us. It creates an opportunity where we can streamline eligibility, streamline the enrollment process, and make it easier for families who are eligible to remain in the program. You know, when you go back to the days of the quarterly status report and all the barriers we erect for families to really make it difficult to get services that they need, I'm looking forward to the benefits of ACA in streamlining that process and make it easier to get into care and stay in care. It has always been a wonderfully rich benefit package that is, you know, kind of suffered a black eye as we talk about, you know, the core value issue of who's entitled to health, those who can afford it or every Californian. And so I'm thrilled that Medi-Cal will have the opportunity to get much more significant support and be a part of a much more global effort to expand healthcare services to every Californian, because I ultimately believe that it really is a fundamental right.
Well, I have the privilege of closing up this event and had the privilege of opening it as well. And I have a few remarks I wanted to make and reflections on what we heard today, and then a little bit of housekeeping as well. Let me just start with one of the housekeepings is this is a great time to start working on your evaluation if you haven't already. But just a few reflections, and one of them is it's great to see Assemblywoman Mitchell there. When we did the survey 12 years ago, she was out here in the audience, and I think we actually asked her to speak and react to some of the findings we heard then. So it's terrific to see her in a different role, caring as much about the Medi-Cal program now as she did then, and she is departed and has very capable colleagues now filling her big shoes. A number of really interesting, I think, takeaways from the survey that we've already shared with you, but from some of the comments from our panelists and from you. Elizabeth's comment about Medi-Cal being the backbone for healthcare reform, I think is certainly something that is in the, clearly in all of our minds. And one of the reasons that we found this survey so important is that if health reform is going to succeed nationally and in California, it's really incumbent upon Medi-Cal not just to make that enrollment process easy, but to provide a card that is meaningful to its beneficiaries. Second is Len's comment Len's comment about how he feels proud about some of the findings, and it made me think about how much it really takes a village to do things, including run a Medi-Cal program, how hard the people of the Department of Healthcare Services work, how committed they are to improving the program, but they're not alone in both feeling proud and in feeling concerned about some of the challenges. We know that you're here because you feel equally as invested in the program and seeing that it succeeds. We know that the legislature is as well. And so it really does take all of us to learn from these findings and to use them in our work to face the challenges ahead. And speaking of a village, it took a village really to pull this all together. And I was talking with my former CHCF colleague, Terry Boughton, at the beginning of this, and remembering that we started this project together a long time ago. And it never ceases to amaze me how long it takes. But clearly this took much more than the work of current and former foundation employees to pull off. I want to really thank again, and I saw him come in, I don't know if he's still here, but Brian Hansen walked in for his support in making this happen. I want to thank the enrollees, the over 1,000 people who responded to the telephone survey, and especially thank the 4 enrollees who agreed to be filmed for the survey. Jolena, Sky, and Theron, who you heard, and then Elizabeth, who you didn't hear. As I said, we have, I want to thank Assemblywoman Mitchell for her participation, and Toby Douglas, again, although you didn't see his video, I really do encourage you to watch that online. We're actually trying to draw people online. So in addition to the fact that we had Len here, we hope that you go online and see an array of resources that we have there for you. I also wanted to say that one of the things I was struck by is how open these findings are to interpretation. So we did our very best to try to provide a spin-free analysis of the findings, to present them as kind of we saw them and as the facts state them. But clearly they're open to interpretation. When 69% say they think the Medi-Cal program provides high quality care, do we say that, wow, a majority, 2/3 of beneficiaries think that it provides high quality care, we should celebrate that? Or do we say the fact that 1/3 don't is really troubling? And I don't think there's a right answer to that. I think they're both right answers. And I think we could go through the survey findings and find that from time to time. And each one of us clearly will put our own interpretation on a lot of these findings, but I hope we can come to some agreement. And I would say that I think the power in these findings, I think the strongest findings are those in which we're able to compare. And that's why I was so appreciative of Len's comments that the department is interested in doing the survey again, because I think if we can compare over time to see whether things are getting better or worse, you may debate whether or not 69% think that it provides high quality care is the right number or not, but if you see it getting better, that's certainly a good sign. If you see it getting worse, that's certainly something to act upon. Likewise, in some of the data about access to providers and access to specialists, you can debate about whether the numbers are good or bad in terms of people's ability to find a specialist, to get an appointment. But when you compare them to the general population, I think it provides a much stronger finding. So I am pleased that we were able to present that to you. Again, I sort of highlight those, I think, as some of the strongest findings. I saw Aaron Auber-Givens and I'm mindful of those of you who are interested in children, and I'm wish that we were able to provide the same comparisons of Medi-Cal enrollees who are adults against the general population. We wish we were able to provide those same comparisons with children, and that's something that when we do a general population survey the next time, we will be mindful of so that we can make some of those same comparisons, because again, I thought those were some of the most valuable. I just want to, before we leave, make two other comments. One is to echo Assemblywoman Mitchell's comment about a performance dashboard and how important that can be. And I hope you will all join me in the efforts that we're working on and we're working on with the department to try to drive towards some kind of performance dashboard. This is a wealth of data about the Medi-Cal program from the perspective of enrollees. As Len said, when they monitor access and monitor the program, they try to bring to bear a number of different resources. I think it is incumbent upon us to agree upon and develop a dashboard so that we can see how well the program is doing and whether it is improving in the ways that we all want to see it. And then finally, in the It Takes a Village theme, a number of people to thank that I haven't already thanked. Our panelists, Len, Elizabeth, Tresa, my colleague Jamie, colleagues out here that have helped put this on, Danny and Michelle and Laura and Karen. And finally, again, all of you that are participating here in person, for your questions, for your interest, for your commitment. Those of you who are still hanging on with us in the webcast and by phone, I want to thank you all. Good day.